Adenomyosis is a medical condition characterized by the growth of the endometrial tissue, the lining of the uterus, into the muscular wall of the uterus, myometrium. This invasion causes the uterus to become enlarged, thickened, and inflamed, often resulting in pain and other symptoms. Key features of adenomyosis. It primarily affects women during their reproductive years, particularly those in their 30s and 40s. The exact cause of adenomyosis is not fully understood, but hormonal factors, uterine trauma, or prior uterine surgeries, e.g., cesarean sections or fibroid removal, may contribute. Symptoms of adenomyosis. Symptoms can vary in severity and may include 1. Heavy or prolonged menstrual bleeding, menorrhagia. 2. Severe menstrual cramps, dysmenorrhea, that worsen over time. 3. Pelvic pain or a feeling of pressure, especially during menstruation. 4. Enlarged uterus, which can make the abdomen feel bloated or tender. 5. Pain during intercourse, dyspareunia. 6. Spotting between periods, in some cases. Some women with adenomyosis may have no symptoms and only discover the condition incidentally during medical evaluations for other reasons. Causes and risk factors. The exact cause of adenomyosis is unclear, but potential factors include 1. Hormonal factors. Estrogen, progesterone, prolactin, and other hormones may promote the condition. 2. Uterine trauma. Damage to the uterus from surgeries, e.g., cesarean section, childbirth, or other procedures might disrupt the boundary between the endometrium and myometrium. 3. Inflammation. Chronic inflammation of the uterine wall may play a role. 4. Age and parity, more common in women who are older and have had multiple pregnancies. Diagnosis. Diagnosing adenomyosis can be challenging as its symptoms overlap with other conditions like fibroids or endometriosis. Common diagnostic tools include 1. Pelvic ultrasound can detect an enlarged or abnormally thickened uterine wall. 2. Magnetic resonance imaging. MRI provides detailed images of the uterus and can confirm adenomyosis. 3. Histopathology. The definitive diagnosis is often made after a hysterectomy when the uterus is examined under a microscope. Treatment. Treatment depends on the severity of symptoms, the patient's age, and their desire to preserve fertility. Options include 1. Medications. Nonsteroidal anti-inflammatory drugs, NSAIDs, to relieve pain. Hormonal therapies, such as oral contraceptives, progestin-only methods, or gonadotropin-releasing hormone, GH, agonists to regulate or suppress menstruation. 2. Minimally invasive procedures. Uterine artery embolization, UAE, reduces blood flow to the affected area of the uterus, alleviating symptoms. Endometrial ablation destroys the lining of the uterus, though it is not suitable for women who want to have children. 3. Surgical options. Hysterectomy, complete removal of the uterus, is the only definitive cure for adenomyosis. Prognosis. Adenomyosis is not life-threatening, but it can significantly impact a woman's quality of life due to pain and heavy bleeding. Early diagnosis and appropriate treatment can help manage symptoms effectively. Women with adenomyosis should work closely with their healthcare providers to determine the best course of action based on their individual needs and reproductive goals.